Hello, and welcome to my Discussion 1 post, Critique of a Rationale. Program rationales are often needed to sell a nutrition program to decision makers and key stakeholders. A strong and effective rationale will convince decision makers to support the program, while a weak rationale may result in a program never even getting off the ground. An effective rationale first starts with a descriptive title. It then identifies the health problem at a macro level, which may be at the international, national, or even the state level. It then relates the macro level problem to the proposed priority population. At both the macro and local levels, supporting data and evidence should be given in clear terms to illustrate the extent of the problem. Next, a concise problem statement should be given to clearly state the problem, why it is a problem, and how it can be solved. The proposed solution is given next, along with a general overview of the program. The benefits of the proposed solution should be put in terms that are meaningful to the decision makers and the key stakeholders. Evidence for the success of the program should be given, and finally, credible resources for the rationale should be included. In reviewing the example rationale from our text, many strengths can be noted. First, the rationale provides a lot of evidence-based support for the extent of the problem and uses social math to put the evidence in easy-to-understand terms. Evidence is given for both the negative impact of health effects of smoking and for the economic impact. The example rationale also does a good job at the macro level and then relating the macro problem to the priority population of the city of Philadelphia. The example rationale also provides some evidence that the proposed solution will create a positive return on the investment, thus saving the city money. And finally, the example rationale includes a descriptive title and credible resources. Although the proposed rationale is quite strong, there are some areas that could be improved in order to make it a stronger presentation. First, although the rationale briefly describes current efforts to fix the problem and gives a high-level overview of the proposed solution, it could do a better job illustrating what is missing from current interventions and how the proposed intervention will fill this gap. Decision makers need to understand what is missing from programs that are already in place. Otherwise, they may decide that the proposed solution does not add any new benefit. Secondly, although the rationale states that the program will be cost-effective and will result in savings, the statement could be better supported by actual numbers and more evidence-based detail. Perhaps a cost-benefit analysis could be done, or actual savings from other large cities that implemented a similar implementation could be provided. Thirdly, the value of the program to the decision makers and key stakeholders could be more explicitly stated. These are the people who will decide whether or not to move forward with the program. What is in it for them needs to be made clear. This requires a good understanding of what is important to the decision makers and the key stakeholders. Fourthly, although the rationale states that the timing is right for the solution, it does not provide any reasons to support this statement. Why is the timing right? Is public support for this problem at its highest? Are there partners ready to provide support? Is healthcare savings a hot topic that will gain support easily? Finally, parts of the rationale include long quotes from other publications. While this creates some credibility, it also makes it cumbersome to read in places. Vital information may be lost in a long quotation. Summarizing these quotes will allow the rationale to flow better and to highlight the areas that are most important to the specific problem and proposed solution. Implementing some of these suggested improvements would further strengthen the rationale, thus creating a better likelihood of the program being passed and put into place.